My delegate ID is 280. Good morning. My name is Akshay Atreya and I work along with Sumit Gupta, and we are second year students at KMC Manipal. Our mentors were Dr. Leslie Edward Lewis, Dr. Kiran Chawla, Dr. Indra Beri and Dr. Prashant Nayak. What we worked on was to find bacteria on mobile phones in an NICU and their potential risk to the neonates. Now, why did we do this study? It's because mobile phones have become so ubiquitous in the community that we don't actually think about whether it can cause any harm to other people around us. And neonates being especially sensitive to all these bacterial pathogens, we chose this topic. We all know that neonates are very susceptible to these infections. So what we tried to do was to isolate bacteria inside the NICU in phones of people who frequently come and go in the NICU. That could be either doctors or healthcare workers or the patient party, including mothers, fathers and other relatives of the child. Even though the healthcare workers and especially the patient party have very limited exposure to the neonate inside the NICU, there is a lot of relation between their touching and the bacteria can transfer in many ways. Even from the skin of these people also it can transfer. So it's a very potent risk that these mobile phones possess. Mobile phones also, they don't have much benefit in the hands of a doctor in an NICU setting. So there is a very disturbing, or can I say very inconclusive risk to benefit ratio in terms of a mobile phone being used inside an NICU. So what we did was, our sample size was 50. We took 50 phones, 25 from healthcare workers including doctors and 25 from the patient party. And what we did was we collected swabs, as you can see like this, in sterile conditions, and we collected swabs from the front, back and even the keys, in between the keys from the mobile phone. And then we incubated it overnight at 37 degrees Celsius on a sheep blood agar plate like this, and we found what all colonies are grown. We used the CLSI guidelines for it for the culture methods, and what we evaluated our results based on of course the bacteria that we found, and also whether it was if we found Staphylococcus, whether it was sensitive to methicillin or not. So our results showed that among the mobile phones, 50 that were tested, 40, that is a massive 80%, had coagulase negative staph. Now, coagulase negative staph is not pathogenic to adults like you or me, but then to a neonate whose immunity is already immature, because immunity is not developed because of preterm or low birth weight or other complications, to them coagulase negative staph is a very dangerous organism, even coagulase negative staph. So 80% had coagulase negative staph, and that is very significant. But we did not find any significant difference between the phones of healthcare workers and the others, and the patient party. That means both categories contribute equally to the risk. Also, we found one sample of E. coli, and that is pathogenic to even adults. So that for a neonate it can be even fatal. Also, one sample showed methicillin sensitive staph aureus, but it's only a matter of time before methicillin resistance also develops. To conclude, we also gave the people a questionnaire so that we could find out whether they had knowledge about hand washing practices, whether they in fact even knew if bacteria could be present on their phones. And we found that among the healthcare workers there was good result. That means they had knowledge that mobile phones can potentially harbor harmful bacteria, but then they didn't do much about it also. And to conclude, I can say that staph we found, that is very dangerous. E. coli, again, very dangerous. So what we can say finally is that it is very impractical to keep a neonate in a sterile environment. That is impractical. But then we can avoid using mobile phones and other such stuff which do not in any way help the neonate, to help the person in diagnosing or treating the neonate. Thank you.